So we're going to be doing IFC simulation for pain today. So the definition of this is interference or superimposition of 4 separate medium frequency sinusoidal currents upon one another, or 2 if we were doing pre-mod. For the effects of this, for physiological, we're going to have some motor nerve stimulation, some muscle spasm reduction, and some edema control. And then for clinical therapeutic effects, we will see some pain relief. So for indications of this, we'll use this for acute pain, chronic pain, pain over or covering a large area, and then muscle spasm. And then for some contraindications, we won't want to use this on someone with an implanted pacemaker. We won't want to use this on someone with a history of heart disease. We won't want to use this over a transthoracic area, and we want to discontinue the treatment if irritation on the skin develops. So for some precautions of this modality, impaired sensation, skin lesions, and then we want to make sure the patient knows that a temporary decrease in pain does not mean the cause of the pain is fixed. So for some advantages of this modality is that it stimulates tissue deeper than the TENS unit, and then it also has a larger cover area than the TENS unit, and then it could possibly be more comfortable for some patients than the TENS unit. Then for some disadvantages, this eliminates pain, but it does not fix the cause of pain, and then this may mask more serious problems going on in the body. And then in regards to portability, it's not very portable. There are a few, if any, portable units available. For some of the parameters, and for our parameters, so for our timing of application, we're going to do this for the acute phase for swelling reduction and edema controlling, and then before rehab exercise to decrease pain and increase range of motion. So when we're doing the modality, I have the 4 pads already lined up on the patient in a cross-sectional crisscross way, this way and this way. When we're setting this up, we're going to go to our machine here, and we're going to select Electrotherapy, and then we'll select the button that says Interferential for IFC, and then we're going to keep all of our parameters the same. So our carrier frequency is going to be 4,000 hertz. Our frequency is going to be 80 to 150 hertz, and then we're going to keep our treatment time set at 20 minutes. So from here, what we're going to do is we're going to turn the nozzle not too fast. We're going to ask the patient to tell us when they feel some sort of sensation, like they're feeling pins and needles, and then we're going to go up to the point where we want it to be strong but comfortable. We don't want them to be in complete discomfort. So we're going to keep going up as the patient says. All right, so the patient said that's a good value. We're going to start it here, and the treatment will start from here, and the timer will count down. Once the treatment is complete, we'll just press stop, and the treatment will stop, and then we'll just turn off the machine. So for our dosage, we're going to want to do the maximum current that is comfortable, as I said before, and it may be necessary for us to increase this number every 17 minutes. And the length of application should be around 20 to 30 minutes. I chose 20. And then as far as frequency of application, we're going to do this once or twice daily as needed, and then we're going to keep doing this treatment until the IFC treatment is no longer effective.